So the treatment of dry eyes basically depends on which layer is deficient. Let's start from the outermost layer, that's the oily layer. If the oily layer is deficient and the patient has complaints of dryness, and we find out on the dry eye analyzer that this is the layer that is deficient, then first we need to check the meibomian glands, which is also checked on the analyzer. The meibomian glands are inside the upper and lower eyelids. These glands secrete the outer oily layer of the tear film. So many times the meibomian glands are healthy, but due to chronic inflammation, they don't function to their optimal ability. So to activate these glands and improve the oily layer, one can either do one warm compress or MeeboSoft treatments. Second, omega-3 supplementation, either in terms of a capsule or to increase the food rich in omega-3 in your diet. Foods rich in omega-3 are soaked walnuts, avocado, flax seeds but crushed, sesame seeds, and salmon if you are non-vegetarian. So increase the intake of omega-3 rich foods. If the aqueous layer is deficient, then lubricating drops such as sodium hyaluronate drops or CMC, they all help. If the mucin layer or the glue layer is deficient, here the glue is manufactured by goblet cells in the conjunctiva, that is the white portion of your eye. These goblet cells should be plump like grapes. However, due to aging, menopause, increased screen time, these cells degenerate, these cells shrink and become like raisins, and they are unable to secrete that mucin properly. This causes a reduction in the tear breakup time, and here we need to regenerate these cells. So how do we do that? Cyclosporin drops really work wonderfully in such cases where they regenerate these cells and make them from dry raisins back to a plump, juicy, grape-like structure, such that these cells can then manufacture the glue-like substance properly once again. And this helps the tear film stick to the eye.